So what we have here are a selection of defibrillators to show you. So this input isn't about the CPR, but it's about the defibs and just getting familiar with them. In the classroom session, we'll give you a chance to have a look at them and to try them. Now there's a variety of different makes and models out there, but they all do the same thing. So part of the issue is about what do you want it for. The larger, the more bulkier the machine, usually is more older and cheaper, and you can get smaller and smaller machines. Always look at the likes of the YouTube channels from the manufacturers to see how they sound, how they operate. Now let's try this one for example. So your machine should always be ready to go. Now these are all just training machines, so they're going to seem a lot slower than the real one would, because the real one will know where you are with the system and it will jump forward if you're quicker, and likewise if you're slower it will slow down. Because these are training machines, they're just on one set pace, so it might sound a bit slow. This cardiac science one, this is the old make. Certainly this is the one that we had in the secure sector back in the early 2000s. The more modern version of this cardiac science one is about a fraction of the size and orange, but the price difference is great as well. With this one you'll have a red, amber and green light system in order to see that they're ready to go. With others you might have a digital bar system. You should always have your machine ready to go, so it should always be showing the green light or the tick or the digital OK sign, and a set of pads plugged in as well. So your pads for example will be in a sealed packet. So these aren't sealed because these are ones that we play with, but they'll be in a sealed packet, and as part of your monthly checks your person should be checking these packagings and making sure that there's been no penetration to the packaging, because if air gets in then it's going to have wasted the pads. So they start either through the likes of opening, which starts the system, or the likes of this one, which we have a number 1, 2, 3 system, and number 1 is green, so we would press the green button to start it. Same with this one, a number 1, 2, 3, we'd press the green button to start it. And this one we have a green button, but we also have a green pull. So with this one, either the pull button or the green start button will start that one. Now we do have a set of real pads here which are expired, but we use them for demonstration purposes. Now these are a good 2 years out of date now, and we use them on courses, but you can still see how sticky they are, and that's what the real pad will look like. Now they'll also show you on the pads where to place them. So this pad for example, when this one comes off, would go on the casualties lower left, and the second pad would go casualty upper right. Okay, so we'll bring that to the camera. So each system will talk you through what to do, but it's about confidence, and you can't ever build confidence unless you really play with the items, and the more that you can familiarise yourself with them. So certainly if you've got a real machine, think about whether you want to invest in the training version of your machine so that staff can play with them on a regular basis and just keep your professional ability there. With this one, we open the machine, it's going to get itself ready. This one also has a dial where it's actually printing the words as well.
Tear open package and remove
so we open
pad.
the package, remove the pads, so the
Tear
real
open
pads will
package
be more
and remove pad.
like this
Peel
solid
one
at the
pad
back.
from plastic liner. Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad and place on bare lower chest as shown. Do not touch patient.
Clear.
Analyzing rhythm. Do not touch patient. Analyzing rhythm. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
So there's the beat, which is what you'd be doing your CPR to. And on this one, the dial is also showing give breath, so then you give the breath. So I'll just close this one down now while we chat about it. So as I said, these are just training versions, so the real pads are going to be a bit different to this, and they're going to be extremely sticky, and your packaging should be sealed and you open it for the first time. So we placed the pads and then it said stand clear, and I raised my hands and said clear. What it's then doing is, if this is the heart, and this here is just for training purposes, this metal strip, you don't really put that on your casualty. But the heart, the muscle mass there in the centre of the chest is the heart. The pads then are on the casualty's upper right, lower left. Those pads, the electrodes are communicating to one another, and what they're trying to work out is there a muscle mass between them that represents a heart, and if there is it then shockable or not? And it's shockable if either it's pulseless but still viable, so it's in the early stages of having stopped, which is typically within that first 20 minutes, or it's in VF, ventricular fibrillation. And if it's either of those, then the machine will charge and ask you to press the button. Now that machine didn't ask me to press the button. When it did the analysis, what it then said was no charge, continue CPR if required. So there it could be something else. Either the heart could be long gone, or the person might be in things like respiratory arrest, and in which case a few rounds of CPR may restart the breathing function. So that machine didn't allow us to charge. But what I'm going to show you now is a machine which is going to let us press that button and discharge. So this one here then, so this is the Philips Heart Start model, and we've got the cartridge here in relation to the paediatric pads. So we've got the adult pads on this model which go upper right, lower left. With the cardiac science with this one, whether it's an adult or a child, those pads go upper right, lower left. With this model, if you're using the paediatric pads, then it shows you the one pad goes in the centre of the chest above the heart and the other pad goes on the back. So again, these are things for you to consider when you're buying a machine. Where do you want to place the pads as well? So with this one then, what I'm going to do, move this one out of the way. To the back. So what I'm going to do with this one is I'm going to start it by pulling. It's either or with this one. So
begin by removing all clothing from the patient's chest.
So we've
Cut
already
clothing
got
if
the clothes cut. We've got them removed. We've cut through any bras. We've shaved the chest if it needs shaved, and we've wiped off any moisture.
Look carefully
We're bringing
at
the
the
pads
pictures
out now,
on the white adhesive pad.
which this one goes
Peel
upper right,
one pad
that
from the
one
yellow
goes lower
plastic
left.
liner.
So even though the training
Place
version's
pad
extremely
exactly as
sticky,
shown in the picture. Press firmly to patient's bare skin. Wait. No one should touch the patient.
and now they're analysing.
Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now.
So there you can see that the
Deliver
button's
shock now.
flashing. I need to press that.
Shock delivered. Be sure the ambulance service has been called. It is safe to touch the patient. Start CPR. For help with CPR, press the flashing blue button.
So there's the blue button flashing. So if I press
Place the
that,
heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 5 centimeters.
and then again it's going to give us
Keep
the beat.
time with the beat. Pinch nose, tilt head, lift chin, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Okay, so I'm going to knock that off now because it's just the training version. But if you have any of the machines on the person for real, you never knock them off, even if the person comes round and says, "Well, thank you very much." Never knock the machine off. Allow the healthcare professional to do that when they arrive. So that's just a very brief view of some of the machines. We are going to practice with them in the class with you. And if after your practical session you have any questions anytime, then please don't hesitate to make contact with us. Thank you for your time.